What if the very system designed to heal us was actually making us sicker? Today, we're diving into the hidden costs of our mental healthcare system. Welcome to Minding the Mind, the podcast exploring the future of mental well-being. I'm your host, and today we have a guest who's been digging deep into some uncomfortable truths about psychiatric care.
I'm excited to be here. It's time we talked about the unintended consequences of a system that, despite its good intentions, can cause real harm.
So, let's cut to the chase. What exactly is the problem you've uncovered?
At its core, we're talking about a system that can prioritize profit over patient well-being, leading to what some are calling a psychiatric industrial complex. It's a network of hospitals, pharmaceutical companies, and other entities that benefit financially from keeping people in a state of crisis.
That sounds like a pretty strong accusation. What's the evidence?
The numbers are staggering. We're talking about billions of dollars flowing into private psychiatric hospitals and pharmaceutical companies annually. The more people are involuntarily committed, the more money the system makes. It is structured such that the system profits when people are in crisis, not when they're well. Every involuntary hold generates revenue. Every forced medication creates an ongoing customer.
So, how does this system actually work in practice? Can you give us an example?
Let me tell you about Jamal, a young man who smoked cannabis to deal with underlying anxiety from childhood trauma. Instead of helping, it triggered a panic attack. His friend, scared, calls 911. What follows isn't healthcare. It's essentially a state-sanctioned kidnapping.
Kidnapping? That's a strong word.
It is. But consider what happened. Police arrive, they force him to the ground, handcuff him, and take him to the emergency room. He's locked in a room, denied contact with family. And then a psychiatrist sees him for 10 minutes and declares him a danger to himself or others.
And then?
Then he waits, sometimes for days, in the ER, because there are no psychiatric beds available. He's given Haldol to calm him down, which leaves him sedated and unable to think clearly. When a bed finally opens up, it's hundreds of miles away from his family and support system.
So, he's essentially banished from his community?
Exactly. He's then subjected to forced medication, strip searches, and a complete loss of autonomy. By the time he's released, he's a shell of his former self, traumatized by the very system that was supposed to help him.
And the cost of this treatment?
Over $40,000. And Jamal is now worse than before. He now has PTSD from the hospitalization itself. He's terrified of the police. He can't leave his apartment. He's lost his job, his college semester, and his sense of self. He's suicidal, not because of the original cannabis panic, but because of what the treatment did to him.
That's a truly disturbing story. It sounds like a system that's designed to fail.
And unfortunately, Jamal's story isn't unique. It's multiplied by hundreds of thousands of people every year. The system isn't just failing, it's actively creating trauma and profiting from it.
Earlier you mentioned this was happening during the COVID era. How did the pandemic affect this?
COVID provided the perfect cover for some of the worst abuses. Extended ED holds became common, often lasting for days or even weeks. Patients were sent out of state, hundreds of miles away, and families couldn't visit due to lockdowns. The facilities, despite reduced capacity, became overcrowded, leading to increased use of restraint and seclusion. And perhaps most alarmingly, accountability went out the window as facilities claimed emergency measures.
It sounds like the perfect storm for abuse.
It was. And private psychiatric hospitals saw record profits during that time. This is why it is critical to acknowledge the unifying topic of the system, the fraud, the violence, and the oppression.
So, what's the underlying cause here? Is it simply a matter of bad actors exploiting the system? Or is there something more fundamental at play?
The problem runs much deeper. The entire system is built on a flawed premise that mental illness is primarily a biological problem that needs to be treated with medication and institutionalization. But what if many of these conditions are actually rooted in unresolved trauma?
You're talking about traumatic stress disorder, or TSD?
Exactly. TSD offers a new framework for understanding what we often misdiagnose as mental illness. Conditions like bipolar disorder, personality disorders, and even cannabis-induced psychosis can often be traced back to underlying trauma.
So, instead of seeing these as purely biological conditions, we should be looking at them as responses to past trauma?
Precisely. And if that's the case, the treatment needs to shift from medication and institutionalization to trauma-informed care, such as somatic therapy, safe community support, and voluntary compassionate care.
That makes sense. But what are the economic implications of this shift?
The savings would be enormous. Instead of spending $40,000 on an involuntary hospitalization, we could spend $500 on a mobile crisis response. Instead of creating iatrogenic trauma, system-caused trauma, that requires years of additional treatment, we could provide effective, early intervention.
You mentioned the term iatrogenic trauma. Can you explain that a bit more?
Iatrogenic trauma is basically trauma that's caused by the healthcare system itself. In Jamal's case, the forced restraint, the isolation, the medication, all of that contributed to a new layer of trauma that he now has to deal with.
So the system is not only failing to heal people, it's actually making them worse.
Exactly. And that's where the real fraud lies. As it was written, Jamal didn't just waste $40,000 on unnecessary hospitalization. He now needs another $200,000 in treatment over his lifetime to heal from what the system did to him.
That's a powerful statement. So, what are the implications of that?
It means that we're not just wasting money on ineffective treatments, we're actually creating a cycle of trauma and suffering that perpetuates itself. We create the mental illness in an attempt to resolve the mental illness. The current system creates iatrogenic trauma.
Let's zoom out for a second. You've painted a pretty bleak picture of the current system. But are there any alternatives that actually work?
Absolutely. There are models that prioritize voluntary, trauma-informed care and achieve far better outcomes at a fraction of the cost. Cahoots in Eugene, Oregon, for example, has been operating for over 30 years. They send crisis workers and peer specialists to respond to mental health calls, and less than 1% of those calls require police backup. And it saves the city millions of dollars every year.
How does Cahoots work?
When someone calls 911 with a mental health crisis, the dispatcher routes the call to Cahoots instead of the police. A van arrives with 2 crisis workers, no weapons, no uniforms. They assess the situation, de-escalate, and connect the person with resources. If needed, they can transport them to a crisis center. But it's always voluntary.
In the results?
Nearly everyone stabilizes without hospitalization. No police violence, minimal cost. It's a win-win.
Are there any other examples?
Phelan's open dialogue approach is another great example. All care is voluntary, even for first-episode psychosis. They send a mobile team to the person's home within 24 hours, including family and support network in treatment. They use minimal medication, only if requested by the patient, and provide intensive support for 2 to 3 weeks, then ongoing. As it was written, voluntary, trauma-informed, community-based care works better than coercion. For everyone. Even people with severe psychosis.
And the recovery rates?
In Western Lapland, Finland, 80% of first-episode psychosis patients recover and return to work or school with no chronic symptoms. Only 20% need ongoing medication, compared to 80% in the traditional system. And hospitalization is rare, only for medical emergencies.
That's a stark contrast to the U.S. system.
It is. In the U.S., the traditional system has a 30% recovery rate, with 80% of patients on lifelong medications and frequent hospitalizations. The difference is clear. Voluntary, trauma-informed, community-based care works better than coercion.
So, if these alternatives are so effective, why aren't they more widely adopted?
Because they're not profitable. The psychiatric industrial complex is incentivized to keep people in crisis, not to heal them. That's why we need to shift our focus from funding hospitals to funding community-based crisis centers. mobile crisis teams, and trauma-informed care.
It seems like the constitutional rights of individuals in crisis are often overlooked. Is that accurate?
Absolutely. Under current emergency custody order laws, police or a clinician can detain you without a warrant, hold you for days without a hearing, deny you the right to refuse treatment, transport you hundreds of miles from home, and forcibly medicate you. This violates the 4th, 5th, 8th, and 14th Amendments.
Those are some pretty serious violations. Why are they allowed to happen?
Because we've decided that people in mental health crisis don't have the same constitutional rights as everyone else. It is discrimination. It is a civil rights violation. It's fraud.
So, what needs to change?
Mental health treatment must always be voluntary. Police should not respond to mental health crises. Mobile crisis teams should. There should be no ECOs without a warrant, and that warrant should require an actual imminent threat, no less restrictive alternative, and due process within 24 hours. There should be no forced medication, except in cases of active violence that cannot be safely de-escalated. And there should be no long-distance transport. Care should happen in the community, within 50 miles maximum.
What about people who are a danger to themselves or others?
True danger is rare, less than 5% of mental health crises. For those cases, mobile crisis teams should respond first, trained in de-escalation. If there's actual violence, police can be called as backup, but not first response. And if there's an ongoing imminent threat, there should be a warrant-based detention with full due process. But for the other 95%, it should be voluntary support, community-based care, and somatic crisis intervention. No coercion. Ever.
This all leads to the unifying topic of the violence and the oppression that are often masked as healthcare.
Absolutely. The psychiatric system's power to detain, drug, and confine people without warrant, without due process, based on subjective assessments of danger, is fundamentally incompatible with a free society. It's a tyranny.
So, what's the bottom line here?
The psychiatric industrial complex is profiting from our suffering. They call it healthcare. It is a fraud. It is violence, it is oppression, and we need to demand reform.
This is a call to action. What can listeners do right now?
First, demand that your legislators pass reforms like the Mental Health Crisis Transformation Act, the Psychiatric Coercion Reduction Act, the Community Mental Health Investment Act, and the Psychiatric Survivors Reparations Act. Support survivor-led organizations like Mind Freedom International and the Wildflower Alliance. Spread the word, share survivor stories, and challenge the narrative that coercion is compassion.
And if you or someone you love is in crisis,
call 988 and ask for a mobile crisis team, not the police. Go to a crisis stabilization center if available, not the ER. Say clearly, I want voluntary support only. I do not consent to an involuntary hold unless I am actively violent. And have an emergency contact know your wishes.
This has been incredibly eye-opening. What's the one thing you want listeners to take away from this conversation?
The most important insight is that the current system is broken, but it doesn't have to be this way. Voluntary trauma-informed care is not only more effective, it's also more humane and cost-effective. We need to shift our focus from coercion to compassion, from profit to people.
Why is this conversation so important right now?
Because millions of people are being harmed by a system that's supposed to help them. Because constitutional rights are being violated. Because billions of dollars are being wasted on ineffective treatments. And because there's a better way. It is time for reform. The evidence is clear. The survivors are speaking.
It begs the question, what kind of society do we want to live in? One that forcibly detains and drugs people for their own good? Or one that provides voluntary, compassionate support to those in need?